Chapter 6 Medical Practitioners 2 A. Hospital Staff. The people who work in any type of workplace, including hospital, are called the staff. The medical staff in a British hospital belong to one of four main groups. A pre-registration house officer, PRHO, or house officer, is a newly graduate doctor in the first year of postgraduate training. After a year, he or she becomes a registered medical practitioner. In the current system of training, the foundation program, the name for these junior doctors is Foundation Year 1 Doctor, AY1. A senior house officer, SHO, is in the second year of postgraduate training. The little is now Foundation Year 2 Doctor, FY2. But the old terms senior house officer and SHO are still used. A specialist registrar, SPR, is a doctor who has completed the foundation program and is training in one of the medical specialties. There are also some non-training registrars, doctors who have completed their training but do not wish to specialize yet. A consultant is a fully qualified specialist. There may also be some associate specialists, senior doctors who do not wish to become consultants. In addition, there is at least one medical or clinical director who is responsible for all of the medical staff. B. Medical terms. Consultant physicians or surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team of junior doctors to help care for those patients. In many hospitals, there are multidisciplinary teams which consist not only of doctors but also the physiotherapists and other allied health professionals. When patients enter or are admitted to hospital, they are usually seen first by one of the junior doctors on the ward, where they will receive treatment and care. The junior doctor clears them, takes their medical history, and examines them. Sometimes later, the registrar also sees the patients and make other investigation of tests, for example, X-rays or an ECG, make a provisional diagnosis, and vein treatments. The consultant usually sees the new admissions, people who have recently been admitted to the ward for the first time on one of the regular ward rounds. When the management of the patients is discussed with the registrar, consultants also decide when a patient is ready to be discharged, sent home. On the ward round, the consultant is accompanied by the team and a nurse, and they decide all the patients is consultant's care. C. Shifts. Junior doctors now normally work in shifts, which means they normally work for 8 hours every day. For example, 7 a.m. to 3 p.m. p.m. and are then free until 7 a.m. the next day. After a week, they change to different shifts, for example, 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is to work from 9 a.m. to 5 p.m. every day and to take turns to be on call. Available to return to the hospital is necessary from 5 p.m. to 9 a.m. the next day. Days on call are set out in a rota or list of names and times. Doctors on call carry a radio, pager, or bleeper, a device which makes a noise when someone is trying to contact them. 6.1 Make word combinations using a word from each box. Associate specialist, house officer, on call, provisional diagnosis, radio pager, and warbone. 6.2 Match the descriptions 1 to 5 with the job titles. 1. Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children admitted to ward. C. Consultant. 2. Dr. Stewart has just started the second year of her foundation program. D. SHO. 3. Dr. C has started his training as a surgeon. A. Specialist register. 4. Dr. Phyllis has just graduated and is working in a large hospital in Birmingham. E. PRHO or house officer. 5. Dr. Miller is in charge of the medical staff in the Birmingham Hospital. B. Medical Director. 6.3 Are the following statements true or false? 1. A medical graduate becomes registered 2 years after graduation. True. 2. The system of training doctors in Britain is called for the foundation program. True. 3. The name senior house officer is no longer used in Britain. False. 4. The consultant is usually first doctor to see new patients. True. And 5. When working in shifts, all doctors take turns to be on call. True. 6.4 Complete the text of a PRHO describing her job. When I get to the ward, the first thing I do is talk to the house officer who has on duty during the last shift to find out if there have been any new admissions. Then I generally see the charge nurse. He tells me if there and anything that needs to be done urgently, such as intravenous lines to put up or take down. Later in the morning, I see any new patients, which basically involves taking a history. On Tuesday and Friday morning, the consultant does her ward rounds, and I have to make sure I'm completely up to date on the patients. After that, there are usually lots of things to do, like writing up rest for foreign blood tests, and so on. In the afternoon, I have to prepare for any patients are to be discharged the next day. They are usually happy to be going home. And then, of course, there are the lectures and tutorials in the foundation program on Monday and Wednesday.